It's my pleasure to be here today, and I think what we need to do is to understand a little bit more about the centre. So first, I'd like us to be introducing Ricky. So over to you, Ricky.
Thanks, Julian. Hi, I'm Ricky Kremer, and I am the Lived Experience Inclusion Lead here at the Centre of Excellence. My job is to make sure that we are always including people with intellectual disability in everything the centre does. And I also work closely with other people with intellectual disability who have jobs at the centre. I'm excited to be here with you today.
Ricky, great. It's really clear that you have a central role in the centre, which is absolutely fantastic. I think we need to talk to our audience a bit more about what the centre is. And in order to do that, I think maybe we should have a Q&A session, and then I'll finish with a little bit of a wrap-up of where the centre's at now. So the first question, I think, for you, Ricky, is what is the National Centre?
Yeah, well, that's a great question. It can be a tricky thing to explain because it is not an actual place you can go to. It is not a place where there are doctors or nurses who specialise in working with people with intellectual disability. We can think of it as a group of people working together to make sure people with intellectual disability can get better health care. And a really important thing the centre does is it creates opportunities for people with lived experience and health professionals to work together. The centre will have resources for everyone to use and learn from. This includes people with intellectual disability, family carers, doctors, and other healthcare workers. It is a centre of excellence, and after all, so we've got to be the best at it.
Well, no pressure, Ricky, but we are striving for excellence, right?
Mm-hmm.
And it's really important that you've highlighted that to do this well, we have to work together. So my next question for you is, what will the centre do for people with intellectual disability?
The centre is going to pave the future for healthcare treatment for people with intellectual disability. It gives people a place to voice their concerns about healthcare and other issues. The centre gives people with intellectual disability opportunities to be recognised as leaders and experts. So you wouldn't give someone a job as a lifeguard if they couldn't swim. So you can't have a centre of excellence in intellectual disability health without people with intellectual disability leading the way.
Absolutely. I'm so glad you've highlighted that inclusion for us. And, you know, given the gaps in healthcare for people with intellectual disability, we've really got our work cut out for us, haven't we?
Absolutely.
Yeah. So my next question for you is, what do you hope to achieve in your role with the centre?
It's not so much about my individual role, it's more about what we do as a team. I get to do lots of different things in my job and be involved with different people and teams. I'll know I have done a good job if people with intellectual disability are leading change at the centre. Personally, what I want to see the centre do is encourage health professionals to actually listen to people with this intellectual disability, them to be genuinely interested in what we have to say.
So it's really about leading change in the centre, but also about leading changes in attitudes and the way healthcare is done for people with intellectual disability. Just so important. Ricky, how is the centre getting to know about the priorities of people with disability, and how are they having their say in healthcare?
Yeah. So by listening to people, it is really pretty simple. We all get feedback from people and hear their stories. And it is important that we hear from people with different experiences. So, for example, First Nations people with complex health or communication needs, and people from different cultural backgrounds. We also talk to health workers and health professionals, as well as supporters. These people have important roles, and we need to hear from everyone involved in intellectual disability.
So listening is really important. And we've recently had a lot of meetings with partners and collaborators. We've sought a lot of advice from people with intellectual disability. We've conducted a big survey. We've met with people. And so we've been able to incorporate the views of what should happen next, including by people with intellectual disability, as we shape the next version of our work together. Ricky, how will the resources help improve the health and well-being for people with intellectual disability?
So people can struggle to find things that will help. So having everything in one place is important. And I don't think there's a lot of information out there, specifically about intellectual disability health. At least not enough information that is accessible and easy to understand. There will be new resources to fill in the gaps that will help everyone work together better.
So we've really got a big challenge ahead of us, haven't we? As we're thinking about how we design a way of making sure those resources are accessible and available to people with intellectual disability. So Ricky, in your opinion, how will we know if the centre is a success?
We are a group of people that are known for giving our honest opinion. So we just say it how it is. The best outcome would be to have better healthcare for people with intellectual disability, but also that we have a voice as to what we want and need for our health. So a good example would be to break the cycle of continuing to go to the local GP and not being taken seriously, not being heard, and having to go back because you're not treated in the right way the first time. So the only people who can tell us the centre is a success is people with intellectual disability.
So Ricky, thank you for being so straight talking. It's really clear that how we measure success must prioritise the views of people with intellectual disability. I'm going to talk a little bit more now about the centre and where we're at with the progress of the work of the centre. And I really do thank the consortium for the opportunity to do so. Jude has already introduced our consortium nicely. The centre is really a once-in-a-generation opportunity to co-design solutions to the health inequalities experienced by people with intellectual disability. The centre is about people with intellectual disability, families, advocates, clinicians, academics, health and disability professionals and services, policymakers and governments coming together. And we need to come together to make something big happen, which will drive improvements in the healthcare of people with intellectual disability over the next 10 years. We have one big goal, and that is to make sure that all over Australia, people with intellectual disability are able to access good quality healthcare that meets their needs. Now you might ask, well, why is that needed in a country with an exemplary healthcare system, one of the best in the world? Well, the reality is that people's lived experience and the research indicate that people with intellectual disability have one of the biggest healthcare gaps of any group in Australia. And it's on the basis of that lived experience and the research evidence that the Disability Royal Commission recently concluded that people with cognitive disability, including people with intellectual disability, experience systemic neglect in healthcare in Australia. And that's a situation we're passionate about changing. So how has the centre come about? Well, it's certainly been a long time coming, hasn't it? There's been a lot of work done over a long time, work by self-advocates, by advocacy organisations, work by researchers and clinicians over time to identify the gaps. It's more than 22 years since initial data on the premature death of people with intellectual disability was published by some of my colleagues, Dr. Sita Devasula, Professor Helen Bianch, and others. And so we're aware that this gap has been talked about for some time, but it's not till more recently that we've developed a momentum and created opportunities for really this issue to be progressed. One of the key things we need to understand is that the centre is funded as part of the implementation of a new national roadmap to improve the health of people with intellectual disability. And so that is a really key opportunity, and one that I know advocates are really passionate about implementing. Now, Jude has introduced the Centre Consortium. What we must understand is that the centre is a co-designed centre, co-led by people with intellectual disability. And I don't think Jude quite mentioned that she's the chair of the council for the National Centre, and she's providing a great leadership role there, as is Ricky in his role as our lived experience lead. Our centre has an administrative hub at UNSW, but we work together in 4 key teams across our consortium and with others. We also work extensively with our 56 partnering and collaborating organisations who play a key role in the work of the centre. We have 4 teams. The Driving Change team models and delivers leadership in driving the changes needed in the sector and driving inclusion of people with intellectual disability in healthcare. Our Health Services Development team builds workforce capability by establishing communities of practice, exploring and experimenting with innovative models of healthcare and evaluating their impact. And it supports the development of the expertise required in health services. Our Resource and Innovation team leads the development of accessible material and will be creating a knowledge exchange hub. This is a one-stop shop where we all come together to exchange information and ideas and to access the resources we need to do a better job. We also have our 4th team, the Research and Data team, that leads the establishment of intellectual disability health research priorities and delivers inclusive research training, research mentoring and leadership, particularly with data, because in order to understand what we need to do next, we need to understand the healthcare experiences of people with intellectual disability. So how is the work progressing? The simple answer is it's progressing very well. Our council is meeting regularly, led by Judy. We have key inputs from a national advisory committee, an international advisory committee, and we're excited to start our First Nations advisory committee shortly. We're doing all of the foundational work to understand and build what needs to happen next. Some key opportunities are coming up. We currently have available 4 PhD scholarships, one each in Queensland, Sydney, Melbourne and Perth, and we're excited to welcome potential PhD scholars who might be keen to work with us to do great research. We also have an opportunity coming up where we'll invite applications for health services innovation work, exploring those innovative models of care. We have completed our first year of foundational work and we're now forming our new priorities. That's it from me today. Ricky, thank you so much for your leadership and for your time in explaining what the centre does.